So how do medical grade light devices like cold laser used in female fertility studies compare with the consumer devices like portable red light devices that I feel have been trending for a few years now? And I think for good reason, but it's important to understand they're not all the same, especially if we're talking about female fertility, and I'm going to explain why in this video. I'll also mention my favorite portable consumer device too, so if you're interested in that, if you're in the market for one, stick around for that. But it's important to understand they're not the same, and also how can we apply this in real life? That's what we're talking about in this video. By the way, I'm Dr. Mimi, and I help couples optimize their health and fertility through a root cause whole body approach. This is part 4 of a series on photobiomodulation and fertility, which I think can be, and have seen clinically, can be a really powerful tool to help optimize egg and sperm quality and the environment these cells develop in. And if you want to learn more, definitely go to the previous videos. Before we get into it, the first really important thing to understand is the wavelength of light being used. So under the umbrella of photobiomodulation, there are different wavelengths of light that have different effects. Red light typically falls between about 620 and 700 nanometers. It's visible, you can actually see the light, and this is excellent for skin and other more superficial tissues. This is what red light masks are all about. They don't penetrate very deep, their effects are superficial, so think skin. Near infrared light, or NIR, is usually above 700 nanometers. It's invisible to our eyes, but it penetrates deeper into the tissue. And here's the very important thing when it comes to photobiomodulation for fertility. Many consumer devices combine both red light and near infrared light, while others only contain red light. So for skin health, red light does a fantastic job. But when we're talking about deeper tissues like muscles, joints, nerves, reproductive organs, near infrared light is generally the relevant wavelength because it can deliver light deeper into tissue. So that 600 to 700 range, not going to get the benefit you're expecting. You want near infrared, so in the 800s. Now, I reviewed some research in the last 2 videos specific to females in photobiomodulation and males in photobiomodulation. What's interesting in the female studies, they were heavily focused near infrared wavelengths, which makes sense. If you're trying to target the uterus or ovaries, you got to penetrate light deeper. In the male studies, which are largely in vitro, so treating the collected semen samples, not treating the male organ, the male testes. So when treating the semen samples, they did respond in many studies to both red light and near infrared light. But what they're targeting doesn't require the light to go very deep when you have the sample in a petri dish versus sperm being produced inside the testes. So that's something to consider. And my point is, for real life application, as a male working to improve his fertility, you probably don't have access to a lab to collect your semen and then use red light on it. What's reasonable and realistic is using a device over the testes. So near infrared is going to be best for both males and females because we got to go deeper. I've had patients get devices and they had only started using the red light wavelengths, and it's just not penetrating deep enough to have the beneficial effects you're seeking. For example, some face masks will only be red light wavelength and don't include the NIR, near infrared. So if you have a device, make sure you have the near infrared option on. So that is a super important thing to be aware of when using photobiomodulation. But when it comes to the difference between consumer devices and medical grade, one of the main differences is how the light is delivered. And before we go there, there's one more thing that matters: dose. Because with photobiomodulation, it's not just about what wavelength you're using, it's also about how much light actually gets delivered, how concentrated that light is, and how much of it reaches the target tissue. Now, there's really only one male clinical study, and they used laser acupuncture. So not a typical cold laser device. So here I'm really focusing on treating women because a lot of the studies used cold laser devices on women. And remember, with women, research shows that we can have impact because photobiomodulation targets mitochondria, which are crucial for egg quality. And also women are the ones who have embryo implantation and develop the baby. So the environment that's happening in is really important. But I will talk about men again later in the video. Most consumer devices, whether it's a panel, handheld, or face mask, use LEDs. All of the fertility studies you've heard me reference in the female studies in this series used medical grade lasers. Both are forms of photobiomodulation, meaning they're using light to influence cellular function, but they deliver it differently. A medical grade laser produces a highly focused, organized beam of light, while an LED produces light that spreads over a much larger area. That means medical grade lasers can deliver much more power to a very specific area, and they can deliver a higher therapeutic dose to deeper tissues in a shorter amount of time. To put the difference into perspective, using our Sumis medical laser, I can deliver 20,000 to 50,000 joules across the pelvic region in about 4 to 6 minutes. Now, if we compare that with, for example, my favorite consumer portable red light device, the Loombox, and I actually had to consult AI to help me put this part together because math isn't my strong suit, but we came up with, based on its published near-infrared optical output of about 6 watts, the Loombox delivers roughly 360 joules per minute. So over a 12-minute session, which is one full session using the Loombox, that's about 4,300 joules. So to reach 30,000 joules, it would theoretically need to run for about 83 minutes, or roughly 7 12-minute sessions. To compare, some of the studies I mentioned for women's fertility are delivering tens of thousands of joules in one treatment session. The largest study I talked about for female fertility, looking at 400 women, delivered a total dose of 20,000 joules. It was 15,000 joules of near-infrared laser light and 5,000 joules of red LED. So one Loombox session would cover about 4,300 joules of the red LED portion, but it would not deliver the 15,000 joules of near-infrared laser that made up the majority of the treatment protocol. And remember, the near-infrared is what penetrates deeper. And even that comparison only tells part of the story. Matching or not matching the total number of joules or the total light output doesn't necessarily mean the treatments are biologically equivalent. We also have to consider how the energy is distributed, the wavelengths being used, we talked about that, the beam profile, the treatment technique, tissue absorption and scattering, and ultimately how much light actually reaches deeper pelvic tissues. With LEDs, the light is generally less focused and more spread out, so less of that energy is delivered efficiently to deep tissue compared with a medical laser. All that to say, a medical grade laser is very different from an LED device in how it delivers energy to the target. That's why the clinical fertility protocols are not directly interchangeable with home use consumer devices. And the price reflects it. You can get an LED for $300 to $700. These medical grade lasers cost much more, tens of thousands of dollars. I think one of ours was around $60K. And I do see some influencers promoting these LED consumer devices using these studies as examples as if they're the same and are totally interchangeable. And they're not. Would it be super interesting to have a study on these consumer devices? Yeah, I'd love to see it. I haven't seen any studies with consumer devices yet. But now that we cleared that up, let's talk about real life application of this. In our clinic, we have 2 class 4 laser systems, the Sumis and the LZR7 ZX2. As I mentioned, these systems are capable of delivering a high dose of near-infrared light efficiently to deeper pelvic tissues, making them much more comparable to the technology used in published clinical fertility protocols. We're still talking about women here. Class 4 lasers were used in the majority of the female studies I discussed previously in this series, the second video. As far as my treatment recommendations with these devices, one, of course, it's different for every client. I take into consideration age, of course, and if you don't understand why, watch the first 2 videos in this series. I take into account underlying conditions and exposures. If someone has endometriosis or gut issues or inflammation, these things matter and can be supported with cold laser. Many times I'll recommend 12 sessions, staying consistent with what some of the studies use. Sometimes I only recommend 6. And so far, that's gotten us great results. I've never had a client at this point, I don't think, use more than 18 sessions. But keep in mind, we're not just doing photobiomodulation when we work together. We are doing so much more that's supported by science to stack the deck in your favor. I mentioned at some point the Loombox is a product I really like. It combines the 660 nanometer red light with 850 nanometer near infrared, making it a great option for general wellness, recovery, and skin health. Could it also be supportive for fertility? I absolutely think it has the potential to be part of the picture, especially as an adjunct between treatments if you're using cold laser therapy or just for consistent home use. Keyword consistent, but it's not accurate to say it's equivalent to the medical grade class 4 laser protocols used in the female fertility literature for reasons I just explained. So if you only have access to a consumer red light device, I wouldn't say it won't make a difference. I definitely think if you have one, it can be helpful. I would say use it consistently. And you need a device that has NIR, not just red light. Loombox is my favorite option here for a few reasons. It's third-party tested, has the lowest EMF exposure. The size I feel like is just perfect, and it has both NIR and red light. You want to hold it close to the treatment area to maximize the amount of light reaching the tissue. And this is not medical advice, by the way. This is for your education. Please speak with your provider for your personal medical advice. But if I had a woman wanting to optimize her fertility, ideally I'd have her come in and get treatment with the class 4 laser, and then they can continue with the Loombox or the red light device at home. Then for men, here's how I think about and apply this. There aren't any studies on males using class 4 cold lasers or even LEDs over the testes. Majority of the male fertility studies I talked about did use low power lasers or LEDs, but they were in vitro studies like I mentioned earlier. So they just treated sperm samples, not the organ, the testes where the sperm are made. The cells they wanted to impact, the light hardly needed to penetrate to get to. They were right there exposed. So applying the research is different for males. Another reason I think is important to consider here, anatomy. In women, the ovaries and uterus are located deep within the pelvis, and the female fertility studies used medical-grade cold lasers designed to penetrate deeper tissues. The testes, on the other hand, are much more superficial, so biologically it makes sense that they may not require the same depth of light penetration to be affected. That's one reason I think consumer red light devices may have more potential in men. You can position the device directly over the testes. So because of these reasons, I don't treat men with our class 4 laser. I think it's more realistic to use a portable consumer red light device from the comfort of your home, because I also consider how it's easier to treat female reproductive organs externally over the abdomen and pelvic region versus treating the male testes externally. The comfort level, it's a little different with the gonads exposed. So I'll usually recommend the male use a portable device regularly at home. Men, your sperm take about 75 days to develop. So using it regularly in the 2 to 3 months leading up to the month you try to conceive would be a great place to start. Remember from the last video, pretty much all of the research supports that applying photobiomodulation to sperm after ejaculation improves motility, which makes sense because that's what mitochondria are responsible for, and that's a main mechanism of photobiomodulation. But to me, it makes sense that if we treat the environment sperm are developing in, we may get improvement in other sperm parameters beyond motility, because we're not just treating sperm when we apply it over the testes. We're treating the environment they're growing in, and a healthier environment means a healthier development. If we treat the sperm after ejaculation, there's only so much we can expect to change. I do have a discount code in the caption for, I think, 42% off the Loombox. I do think it's a great investment, and I always joke that whatever issue you have, you can probably just throw light therapy on for reasons I dove into in the first video of the series. It helps things heal. So if you got a headache, throw the Loombox on it. Knee injury, sore throat, neck hurts, use the Loombox. There's studies on how it can support thyroid function and liver function. And of course, you can use it over the pelvic region for females, and men, like I just talked about, can use it over their testes. One study did find that cold laser does not penetrate deep enough to impact a developing embryo, but better safe to be sorry. So I recommend not using it, any form of light therapy, directly over your pelvic region or abdominal region after ovulation if you're timing intercourse for conception that cycle. I do often tell my clients to continue using it over their neck after ovulation and even the low back. But again, talk to your provider. This is not medical advice for you. I do think this research is most exciting for women because we're treating not only the environment your eggs are developing in, but also the environment the embryo will implant and develop in. Women notice improvement in their gut symptoms, their period symptoms, their cramps when we use this therapy, and often much more. While we still need larger, high-quality human trials, the mechanisms are super compelling, and the clinical results I've seen so far are just so exciting. So here's what I want to leave you with. Fertility starts in the environment your cells develop in, and the gut, the mitochondria, the inflammatory load, all of that shapes the environment. Photobiomodulation is a simple, natural, non-invasive tool that appears to intervene at several of those root levels at once, helping rebalance the microbiome, lowering inflammation and oxidative stress, protecting the gut barrier, improving insulin sensitivity, enhancing, of course, mitochondrial ATP production, and even increasing blood flow to reproductive tissues. But something that's also important to understand, I don't think it's a substitute for addressing the root cause. Yes, it's a powerful tool that helps create a healthier environment, but it works best when it's combined with everything else that supports healthy reproductive function. If someone has chronic inflammation, sure, we can use cold laser to help calm it, but I want to know why they have chronic inflammation. If blood flow is compromised, I want to know why. If someone's nutrient insufficient, we still have to replete those nutrients. If insulin resistance or gut dysfunction is present, those deserve attention too and can still impact outcomes. So I don't look at cold laser as a singular treatment. I look at it as a powerful piece of a much bigger strategy. It's a powerful tool that helps restore function while we simultaneously work upstream to create the healthiest possible environment for reproduction. And that's really the philosophy behind everything I do and teach on this channel. If you'd like to read the studies for yourself, go to the previous 2 videos. And the first one is where I explained some of the mechanisms of photobiomodulation. And if you enjoy this video, I'd love for you to subscribe because I'll be doing much deeper dives into the research and fertility and what influences it from a root cause perspective. And lastly, if you know someone trying to conceive who might benefit from learning this information, send them this video. You never know whose journey it might change. Thanks, and I'll see you in the next video.